Just by way of quick background, GRACE is a new organization. GRACE is an acronym for Gather, Respect, Advocacy, Change, and Engage. Our goal is, through research, analysis, and advocacy, to make a positive impact in the lives of low-income children and their families. We were formed by the Daughters of Charity, who have a organization, Ministry Services, that run a whole range of social service, educational, and healthcare programs and ministries across California and the western states. The Daughters have been doing this kind of work for 375 years. That's 375 years. In 1856, just after the Daughters first came to Los Angeles, they opened Maryvale, where we are today. Maryvale was originally at the site of what's now Union Station, and it was the first orphanage in Los Angeles. And about that time, the Daughters also formed the first hospital in LA. I hope you take the time to learn a little bit about Maryvale. There's a table in back that describes some of its work, and there'll be a tour at the end of the day that we encourage you to take part in. Maryvale provides a range of services for children and their families. This facility is a residential treatment facility for especially girls in foster care that require intensive therapy in order to return to non-group home settings. In thinking about the conference today, I think it's helpful to think about it in terms of identification, consensus, and implementation. Identification, consensus, and implementation. Now, there's been a great deal of work done in foster care, and a lot of it by many of the people in this room. But there are obviously very significant gaps and weaknesses, areas of underfunding, understaffing. So there's a lot that needs to be done, and we've got a range of some of the real statewide experts and leaders that are going to be with us today. And we're not going to be able to tell, I think, the success of this conference for probably 9, 10 months or a year, because the test of our success has been whether in the course of the discussions and the panels we've been able to identify the areas of weaknesses and the gaps, whether we've been able to reach some consensus, and then whether we've done something about it, whether we've been successful in fixing those things. So we have a full schedule, and a very full schedule, and we're going to try to move things along very quickly.